My name is Lindsay Cox. I'm the Senior Manager for Advocacy and Outreach here at HFA. Thank you so much for joining us. And I'm joined by a couple of my colleagues. We have Cynthia Cross, Miriam Goldstein, Mark Hobrock, and Shira Smiley, along with some other HFA staff that are on the call. But thank you so much for joining us, and we're very excited to get started. So next slide. We're going to talk a little bit about HFA. So if you haven't heard of us, welcome. Hopefully many of you have. We are founded in 1994. We are a nonprofit nationally that assists, advocates, and educates for the bleeding disorder community. So hopefully you are all familiar with HFA at this point. So here's a couple of things we're going to cover today. We're going to talk a bit about the end of the public health emergency, what happens, how to prepare for it, and various resources that we can provide and that what patients need. We'll talk a little bit more about the public affairs team as well as the Helping Hands team, and have some additional resources for you, focusing more on insurance, financial assistance, and more that we and other third parties can provide. So starting off with the COVID public health emergency, PHE unwinding, we're going to talk a little bit more about that. And if you have any questions, by all means, please put them in the chat and we'll get to them and answer them. We want this to be interactive. So the impact of the PHE on Medicaid funding and enrollment. So as many of you know, at the start of the pandemic back in January 2020, Human Health and Services declared a public health emergency, and that declaration lasted originally for 90 days, and it's been continuously renewed since then in 90-day increments. So with that, essentially what happens when we enter the public health emergency, there have been boosted matching federal funds. There are specific things that get initiated when a public health emergency has been declared. So state Medicaid programs cannot disenroll Medicaid beneficiaries for the duration of the public health emergency. So since the start of the public health emergency, Medicaid and CHIP have increased by more than 25% or 19 million nationwide. And much of this is due to the pause on disenrollments. So what happens when the public health emergency ends, right? So we'll talk a little bit more about when we think it's going to end, but essentially, states will resume eligibility redeterminations for 88.3 million Medicaid enrollees, and they have to be completed within 14 months. So as you can imagine, that's a lot of redeterminations to happen in a very short amount of time. Medicaid coverage could be terminated for up to 18 million enrollees by the end of the year, and that can include nearly 7 million children. So we're talking large amounts of folks, high numbers of our bleeding disorder community. So who's at risk for losing coverage? Who are in that 18 million? Well, the Urban Institute has very recently projected that 3.8 million will completely lose insurance, and some will be no longer eligible for Medicaid. So if you, became ineligible during the public health emergency because there were no redeterminations, you were still on Medicaid, but with the redeterminations, there were some that will be no longer eligible. So those people could be folks who are earning, whose earnings now place them in a higher category of income above Medicaid coverage. And some in this category, depending on the state that you're in, may be eligible for ACA marketplace plans, but will need help navigating through those options. And for those living in non-Medicaid expansion states, there are some folks that have aged out of Medicaid eligibility. So additionally, some will lose coverage just due to administrative issues. And that could be folks that have moved, that don't have up-to-date contact information on file, or people that have problems getting through the red tape and bureaucratic process. There's going to be a lot of that, unfortunately, and we're all going to need to help our patients navigate through what's going to be a bit of a tumultuous period. Unfortunately, this also has a disparate impact. More than half of coverage losses will be those no longer eligible, and HHS has said that 8% of Medicaid's total enrollees, nearly 50% of those that will be disenrolled, will lose coverage due to administrative issues, which is a high number, as I mentioned. And nearly 500,000 will fall into that coverage gap in those non-expansion states. And what that translates to is that a lot of disadvantaged groups like children, Latinos, African Americans, all have a higher rate of coverage loss. So we'll need to also be mindful of that when taking a look at some of these challenges. So specific issues with this, we could have a couple of slides on this, but we'll just sum it up to these. Medicaid has had huge staff turnover during the public health emergency, as much of jobs nationwide has. Medicaid's no different. So up to 40% of staff in some states have never handled a termination. So that's going to be huge when we have millions of folks all of a sudden being eligible for redetermination, and there could be, millions of terminations. And so the question is, will they be sufficiently trained and able to timely process these redeterminations? The increased FMAP ends the following quarter after the public health emergency expires, which incentivizes states to very quickly do these redeterminations, which could cause a bit of havoc. Enrollees will receive only a 10-day notice before their benefits are terminated. And they should be able to appeal that within 90 days. But the question is can enrollees appeal if they have not timely responded? And can states handle the number of appeals and act on them within that 90-day time frame? Enrollees who earn too much now will need help transitioning in care. Will they enroll in CHIP? Will they enroll in marketplace plans, premium cost sharing? And will enrollees be able to navigate through the red tape and, somewhat confusing redetermination process that could take up to 14 months? So there's a lot of questions here. So you may be asking, okay, when is this all taking place? A very great question. I wish I had a definitive answer for you. What's been happening is, as we mentioned earlier, every 90 days, the public health emergency has been renewed. So HHS has promised that they would give us 60 days advance notice before the expiration. So currently, the public health emergency declaration expires January 11th. However, because we haven't received the 60-day advance notice, and HHS has said it would be renewed, it will be renewed. We just don't know how long it will be renewed for. 90 days is the maximum amount of time it can be renewed for, but it could be 30 days, it could be 60 days, it could be, 47 days, right? It could be any number of things. So we don't know how much longer and if it's going to be renewed past that. But there have been a couple of calls to action in terms of various groups that have called on Congress to act to try to stop the public health emergency from continuously being renewed. The National Association of Medical Directors has called on Congress to act. They've asked for certainty on the public health emergency requirements. They're saying basically that the end date is no longer tenable in the sense that it's being continuously renewed, and it's hard to set up any kind of campaign or certainty with when all of this is going to begin. So it makes it a little bit more challenging. So they've asked that the Biden administration and congressional leadership set in statute a date so that folks can prepare. You can read more about that in the full story, and essentially prohibit CMS from changing Medicaid eligibility rules during the redetermination period and all these different qualifications that would happen during that time. So the Senate voted last month to end the public health emergency. The House didn't take up the bill, and the president threatened to veto it if it passed. And the question is, as well as, will states choose to reject this extra money that they may get and resume this disenrollments ahead of time? So there's a lot of questions up in the air, and it's going to vary state by state. There are some states we'll talk about that have wanted to do it a lot sooner than others, and that's why we're here to all talk about this together and prepare for what's coming. So preparing for the end of the public health emergency. So the federal government has issued guidance to state Medicaid agencies on how to promote the continuity of coverage and minimize those wrongful and erroneous terminations, right? So HFA and coalition partners are monitoring state plans and for resuming redeterminations. And as the public health emergency winds down, we're going to be all over social media, email blasts, you name it, working with member organizations, all of you, to remind patients to update their contact information and to respond promptly to all Medicaid communications. At the moment, that's the most important thing, is to update their contact information. We know several people obviously have moved. There's been a lot of change in the past 2, nearly 3 years since the pandemic has occurred. So that is very important to make sure that all of that is up to date. And we'll continue to develop educational resources and for coverage options for those who may lose Medicaid. So states are varying in their plan to tackle this, right? So as I mentioned, per CMS, states have no more than, should spread out the redeterminations to no more than 1/9 of caseload per month. But there are several states that indicated they won't do that. So Ohio's budget requires redeterminations to happen in 90 days. That's quite a bit different than 14 months. Arkansas, Idaho, New Hampshire plan to do it in 3 to 6 months. Missouri, Nevada, New Mexico, Texas, 6 to 9 months. So it's going to be different for every state. Oregon created state coverage options for those who lose Medicaid once the PHE expires, including temporary Medicaid expansion. So we're seeing some states look into those kinds of options. California will automatically enroll individuals losing Medicaid into marketplace plans, which other states like Massachusetts and Rhode Island are also considering. At least 13 states are seeking CMS approval for express lane eligibility, which is to use data from public welfare programs to help with their eligibility redetermination. States can rely on different data sources to verify eligibility, including Medicaid's managed care plans, but the information must be recent and reliable. So one of the big highlights here is that data from the enrollee's last renewal or initial application is not sufficient because it's been so long since that's happened. So state examples. So states have, as we mentioned, every state is kind of tackling this differently, right? Many states have created unwinding toolkits or other guidance to providers and stakeholders to act as these messengers to get the word out, right? And to educate enrollees on how to protect from coverage terminations. So they've included sample flyers, talking points, social media posts. So highly recommend going and checking out your state and seeing what kind of resources they have. So here are a couple of options from different states. Absolutely, you will. Great question. There will be a recording of the session later to review, as well as we'll send out the slide deck. So there are various states here. These are 3 different states. Oregon is here, New Jersey, I believe, and another state that I can't recall. But these are different options that I think South Carolina for things that you can post on social media, that you can send out, print out flyers, give them to patients. So there are plenty of options that they've provided as well to help get the word out. So highly recommend going on those sites. So a basic summary, and feel free to throw questions or comments in the chat. The COVID-19 public health emergency is likely to extend past this January. We didn't get the 60-day notice. We just don't know when. It hasn't been announced yet as to when it will be extended to, or if it'll be extended again past that. Federal COVID-19 flexibilities and the pause on Medicaid terminations will continue through that time. And then as soon as the public health emergency ends, it all begins and the redeterminations process kickstarts, and at least 18 million enrollees could lose Medicaid coverage during those first 14 months or sooner. Despite the fact that many will still be eligible. So we're going to really need to particularly work with that subset to make sure that they have coverage, and if it is a wrongful termination, going about reinstatement. The speed and scope of coverage losses will vary by state, and it's critical to remind enrollees to update contact information with Medicaid programs and timely respond to termination notices given the likelihood of erroneous terminations. We have some resources here. There's a 50-state unwinding tracker. There's waiver approvals, unwinding toolkits, all different kinds of stuff. We highly recommend you check that out when we send out the slide deck. That could be very useful to you. Questions? And feel free to also unmute if you would prefer, if you can't type fast enough. Fabulous. All right, we're going to keep going. Feel free to continue to put questions in the chat. By no means has the conversation ended there. Resources and roles offered by HFA's public affairs team. I want to introduce you to our fabulous folks that we have on the team. Our fearless leader, Miriam, who's our acting vice president of public affairs. We also have Mark Hobrock on. I'm Lindsay Cox. I think Janet Chupka is also on. Adrian and Whitney, we're a dynamic team that covers a lot. And we do everything from policy and advocacy to research, engagement, outreach, you name it, and we're probably doing it. The HFA public affairs team, we seek to deliver advocacy education over 3 overlapping umbrellas. So patient and community outreach and engagement, policy expertise and analysis, and member organization support and outreach. So here are a couple of different resources and services that we provide that we work with member organizations or patients community to serve, but also we can work with all of you to connect with patients as well. So we have webinars and podcast series. This is one of our webinars for you all. We do this on a variety of different topics, and we frequently post them to our YouTube page and our website. We've got our Word from Washington monthly posts and social media blasts that are updates from what's going on federally. Washington Wire is our breaking news. If there's anything emergent that comes out or something for immediate posting, that's what that is. We have Q&A blogs. We have advocacy actions of the month posted on our social medias, educational sessions, storytelling projects. If you haven't checked out, if you're interested in advocacy, go to our Learning Central platform. They have an advocacy module that is a great way to get started. And we also offer expertise and assistance. We have project calls, which is something that several of you may be familiar with. Project calls is something that essentially if someone's having a health insurance issue, if they're running into a challenge or a barrier or have a question or are confused, we have a form that they can fill out. It's great to collect for advocacy purposes, but also we'll help walk them through whatever that issue may be and help try to eradicate whatever barrier that they're facing to access care. We also have an advocacy working group as well that gets going. Policy expertise and analysis. So we do a lot. We work on the state and federal levels. We produce comment letters. We have a legislative action center that is live on our website. If you want to take advocacy action within 60 seconds today, it's just that easy. Highly recommend going on, and all you have to do is put in your name, email, and address, and you can send a letter to your legislators just that quickly. We also collaborate with several national and state-based coalitions. We work very closely with our member organizations, hemophilia treatment centers, and all of you, of course. We do in-depth policy analysis and, of course, safety monitoring, blood safety and product safety monitoring within our community as well. And member organization support and outreach. We talked about state policy comment letters. We're there to support state legislative days and frequently allow the use of our Legislative Action Center. We provide legislative and regulatory experience and analysis, and continue to offer educational sessions at several of these meetings as well. And additional programs and offerings. So we also provide several different kinds of programming. These are some of my programs that I run, so I'm a little extra proud. But we do a week of advocacy, a national fly-in where you can see the photo on the top right. Our last fly-in where we brought folks down to DC and we're back on the Hill advocating. We have a congressional reception where we honor Congress folks for being champions of our community. We have a government relations internship. We have our intern, Brian, at the very bottom there. A young adult advocacy summit. We have various programming on insurance boot camps and navigating through products and emerging therapies, our Dateline series. We have a bleeding disorder health disparities council, community needs assessments, advisory groups, medical industry, specialty pharmacy, and listening sessions and roundtables that our fabulous, formerly research, now engagement and community health team works on, which is outstanding. So thank you. That's my half of the presentation, our public affairs team. We're going to turn it over very briefly in a minute to our fabulous Helping Hands team. I'll put our contact information in the chat. By all means, please don't hesitate to reach out if you have any questions. And with that, I'll turn it over to Cynthia and Shira to talk a little bit more about Helping Hands and resources.
Hello, everyone. Cynthia is just pulling up the presentation momentarily, and I think we're good to go.
Sorry, thanks, Shara. I could not get myself unmuted there. Anyways, thanks for joining. So I'm Cynthia. I'm HFA services manager, and then Shira is one of our services coordinator. I recognize a lot of names on here, so you probably have heard from both of us a lot if you refer at all to Helping Hands. But we'll do a quick overview today of our programs. So we have 4 financial assistance programs. Our main one and the biggest one we usually run into is emergency assistance. And then we also have an items assistance, inhibitor support, and disaster relief, which Shira and I will talk about more later. And then we also have a resource portal that is slowly but surely being transported to our website and is going from very bulky PDFs to a really awesome sortable system, in hopes of making it easier and just more manageable. And then we offer our job readiness grant through a Helping Forward program, which is a branch off from our Helping Hands, and something we're really actually super proud of on that one. But our emergency assistance, like I said, is our biggest program. It helps with urgent financial needs. We can cover 1 housing, utility, or transportation bill. And we also like to note that we can also help with burial or funeral expenses for an individual with a bleeding disorder. This is available to households that have an eligible bleeding disorder. They do have to have a professional referrer, which means a doctor, nurse, social worker, anyone from a bleeding disorder organization, basically anyone who's actively involved in the care of their bleeding disorder. They can have 1 application per household per 365 days. And to kind of clarify what that long sentence means, so if you were to refer someone today, that means that they would not be eligible again until next year on December 7th. And then we hope to help through any financial hardship they're experiencing. So this is for anything causing, or that was caused by their bleeding disorder. So like medical bills or anything majorly impacting. So we look at that as well as, you know, if you're going to be evicted from your house, it's obviously going to impact your ability to care for your bleeding disorder. So I know that wording, sometimes people think it has to do with the bleeding disorder directly, but if it's going to impact them and their ability to care for their bleeding disorder, we're here to help in any way that we can with that. And if you're approved, then we make the payment directly to the bill company or a property manager, really trying to help in that process as well. And then Shira is going to share about items.
Hello, everyone. My name is Shira Smiley. I'm the services coordinator for the Helping Hands program. I do see a lot of faces that I've only ever communicated via email with, so hello. I also do want to say that I am the only Spanish-speaking staff person in the Helping Hands program, so if you have any patients or clients that speak Spanish, they definitely will have interacted with me. The maximum grant for emergency assistance is $750. For items assistance, we assist with durable medical items such as medical IDs, protective gear, mobility supports, wheelchairs is another common one, or ramps. The medical item must be for the person with the bleeding disorder. So unlike the emergency assistance program, individuals can refer themselves to items assistance, but we will require a verification of the bleeding disorder in the medical necessity for the item. There's a form that's on our website that the medical professional will need to fill out, and individuals can apply for throughout the year. Dental bills are not eligible under the items assistance program. We do not pay for medical bills, Lisa. The maximum amount of assistance for items assistance is $750, and we can either pay for the medical item upfront, or if the individual has already purchased the item, we can reimburse them. Awesome.
And then we have inhibitor support. This helps with medical travel or education support that's related to the bleeding disorder. And it has to be for a household that has a person with a bleeding disorder who also has an active inhibitor and will need medical verification of the bleeding disorder, the medical need, as well as the active inhibitor. And it can be a professional or self-referral as well, just like items. And medical travel is any kind of treatment, second opinion, anything dealing with the bleeding disorder. And educational support, we actually just extended it to college students as well. But any tutoring or educational supplies that are needed to help, especially if it's related to them having to miss school because of their bleeding disorder. And this is also one that can be applied throughout the year. The only program we have that cannot be utilized throughout the year is our emergency assistance. And then disaster relief.
And then we also have disaster relief. So this was a very popular program this year, unfortunately, due to all the disasters that we've had throughout the United States. Thinking of Hurricane Fiona, which, you know, greatly impacted Puerto Rico and Florida. So this is another program that we have that will benefit bleeding disorder families impacted by natural disasters declared by FEMA or National Weather Service. So that includes, but not limited to, tornadoes, hurricanes, floods, wildfires, earthquakes. And these funds are designed to help individuals recover their household essentials, right? Things that they may have lost as a result of that disaster. We do, for this specific program, an individual can refer themselves, a medical or healthcare professional also can refer that person. We also, Cynthia actually keeps track of the national disasters going on, and she does reach out to the member orgs that are affected. For example, if there was a tornado that the National Weather Service was scheduled to hit Iowa, she would be in touch with the local organization, Bleeding Disorders Organization in Iowa, to contact them to let them know that we are here and ready to help. And again, we can reimburse or purchase those items up front. And these 4 programs, just so that we're clear that Cynthia and I are talking about, are separate programs. So an individual can apply for emergency assistance, but also they may need protective gear or a wheelchair. Those are 2 separate programs, essentially 2 separate pots of money. So individuals can benefit from multiple programs at the same time. Any questions about the first 4 programs we just discussed? I know it was a lot of information. All right.
I guess there was just a clarifying question that I'll come up. So someone said, what is the maximum grant amount allotted for Helping Hands? Is each program $750 or is it different for each program?
It is different for each program. $750 is for emergency assistance, and then items, inhibitor, and disaster relief are different. And they also have different, it's more of like a scale depending on need, especially for disaster relief. We can go higher for those obviously experiencing significant impact from those disasters. And then for items, it's $750 for regular items, and then we can go up to $1,000 for mobility support. And we make that mobility support a very wide bracket. So that can be wheelchairs, it can also be ramps and making the house accessible. But we always say that, we are very open. We obviously have a cap that we have to hit up, but we try our best to support as much as humanly possible. And then I know one question we get a lot of that we kind of wanted to use some of this time to share about is our application process, which we've actually gotten much quicker at getting through since I think about April this year. So we'll get a referral. It's has to be a professional referral. If it is emergency assistance, any of our other programs, then it is a self-referral or a professional referral. Then they go through an eligibility screening. So that just means we go through our eligibility criteria, make sure that the bleeding disorder is one that we can help with, and then that they have eligible expenses. And then we process the application call. That is a different time for each program. So disaster relief, we try to do it immediately because obviously they were just impacted by a disaster. So we really try within the first 24 to 48 hours of getting that application. Granted, unless it comes on like a Friday night, then it's usually Monday. But we absolutely try our hardest to get that one responded to immediately. For emergency assistance, that one we have 10 business days. If it is peak time, it might be closer to that. Sometimes when you hit it just perfectly, we can get that call made within the day that that referral is submitted and have 24-hour turnaround. It really just depends on our queue at that time. But that one is 10 business days. And then for items and inhibitor support, it can be up to 30 days to process that call. Lately, I don't know any that actually got to that point in time, but that is just because we process disaster relief and emergency assistance, they get our attention right away, whereas those items and inhibitor can wait a little bit unless you notify us that it's urgent, and then it moves to the top and we process it if there's a significant time delay or a time need, especially for emergency assistance. If you have someone who is going to be evicted or repossession, shut off, anything like that, please note it in your notes that it is urgent, and it jumps to the front of our line and it is the person that we contact right away. So that is one thing I always like to make note of, so that, because I know that 10 business days can be really long if you're looking for an eviction. So please, if it's urgent, note it on there and they'll be our first call. And then it's a application is completed in a phone call with the applicant. So one of our team members will call for emergency assistance. It's about a 20-minute phone call. For all of our other programs, it takes about 10 minutes just because we require less information for those programs. A decision is made based off of the application completed by the coordinator or manager working on that one. And then we notify applicants, get any documentation that we need based on what program they do, and then we complete the payment and follow up with resources. The resources we follow up with is a long list, but we try and cover everything that we think could have immediate assistance, and then as well as a link to our more thorough, longer list of resources on our website. And they cover anything from more financial assistance to education supports to connecting them with local orgs if they're not already connected to them. And then mental health resources as well, because we are well aware that financial strain is a huge impact to mental health. So we try and support in every single way that we possibly can. But before I move on to our job readiness grant and helping forward, any questions about Helping Hands or the application process or any of that loveliness? I can't. Wait, there we go. Okay. Looks like everything in the chat was answered, so I will move on. So our job readiness grant is the biggest part of our Helping Forward program. And honestly, like Lindsay said, her programs are her like pride and joy. This is one of mine. And I'm really happy to announce that we just got notification that we will be able to offer this again next year. So we will be sending information on that at the beginning of next year. So I guess really in like a month to talk more about how this grant will look moving forward, but it will cover up to $1,000 for any training course or certification. It is available to adults 18 to 64 with an eligible bleeding disorder. And the application is super quick. We try to make it as painless as possible. It's just a 2-page online application, brief statement of need, kind of going over their barriers to sustainable employment and how this course is going to help them either maintain or gain sustainable employment. It includes a resume, documentation of bleeding disorder, which can be visit notes, literally anything that's from a medical professional and has their name and diagnosis on it, and then the documentation of the cost of their course. And the first year we did it, it was a set deadline. Last year it was split. We did a set deadline, and then we also did rolling applications. Moving forward, it would be fully rolling applications. So applications we submitted by the applicant, they will be reviewed for eligibility and sent to our committee for review. And the committee gets about a week to review it. And then we hope to have everything in that process done well within 1 month of applying for support. And we like to make a note that the training course or certification can be for anything that will help gain employment. So if they just need a skill to brush up on, if there's something that they've just been dying to try, if they can tell us how it's going to help them get employment or keep employment, we're happy to make it something hopefully that we can help with. Let me see. So there was a question in the chat, but I'll just tell everyone in case it's a question that comes up. For the job readiness grant, it doesn't need to be a referral from any professional. It is by the applicant themselves. They can go in and fill it all out. So if an applicant does not have a resume, we have a Learning Central course on employment rights and kind of the search of it that helps walk through step by step how to write a resume. If they just have education experience, so we've had a few college students apply to it. It would get them a good start on how to do a resume and get that started for them, even if it just contains the education that they're seeking and how this course is going to work with that education. Any other questions about job readiness grant? All right. Yep, Lindsay.
No, I think you just answered it, but what if an applicant does not have a resume?
Yep, I just saw that one.
Yeah.
Awesome. So our resource portal is currently under construction. So we used to have really bulky PDFs, and it got really overwhelming because we try and give everything under the sun of resources because we want to help, but then it became really long, really hard to navigate. So we have an awesome website guru at HFA, Kirsten, and she is making all of our resource lists into sortable ones on our website. And it's still going to cover all the same areas. So we have financial assistance, financial planning, drug manufacturer assistance, which Shira and I are going to go through most of those programs today as well. But they'll also be on our website. Hepatitis C and HIV resources, mental health resources, and then probably a big chunk of them are employment rights and job search. There are also courses on Learning Central for those. So that is currently in the works, hopefully should be done within before the end of the year. I do know financial assistance is our biggest one that's requested, and that one is fully functional and on the website. Mental health is almost there, almost completely on. But if you ever have a question about resources that you're not finding, or if you have a specific area, always feel free to reach out to our team. We love being resource guides in that way and kind of love investigating all of that. So definitely happy to help if there's any question on resources that you're not seeing there. All right. Sorry, I was just checking the chat, making sure I wasn't missing anybody. So talking about those awesome resources, we do have a quick kind of overview of some of the drug manufacturer assistance programs, just to make sure that, we're sharing kind of some of the resources that we have. We're in no way offering medical advice or promoting any specific manufacturers, anything like that. We just want to make sure that we're sharing the resources that we know about. So one of the big ones is PAN Foundation, and it's a needs-based program that provides assistance to specific diseases, and then branched off of that, once you find the disease named in the assistance program, they cover certain medication expenses. Like almost every one of the ones you're about to see, we have seen that they will only cover it for individuals living and currently receiving treatment in the United States. For PAN specifically, they don't have to be a U.S. citizen. There are some programs that do require U.S. citizenship to access, but these will all also be part of the slide deck that you get. So don't feel the need to write like crazy, because we will try to go through these a little bit quicker to have questions at the end for you. So Bayer is a big one. They have a patient loyalty program, a free trial, reimbursement for lab testing, and a copay program. Some of these are very specific to the certain brand that you are getting from them. So we always recommend to check on their website or call them and make sure that the brand that you're looking for is actually covered through these programs. CSL Behring has an assurance program, so that makes sure that there's treatment during any lapse in health care insurance. It is for private insurance. That is a big one that we see a lot in these programs, that they do not often support those on Medicaid or totally blanking on. Triker, the military programs or any kind of like federal insurance, it typically has to be a private health insurance. And then CSL also has a copay insurance. But if you go to their website, you'll see at the bottom, they have a ton of brands listed because each brand also has their own programs, which you might find even more of reimbursement support, patient assistance programs, self-administration training, education, and free trials. It just depends on the brand of medication that they're using. Genentech has an access solution, so they investigate benefits and provide referrals to those that need it. They also have a patient foundation getting free medication to those without insurance or those who cannot afford their insurance. And Hemophilia has its own copay program. And then Grifols has Factors for Health. So they have copay assistance, free trial program. They also have a benefits investigation and a patient assistance program and care coordination. And then Shira is going to take it over.
Hi, everyone. So I'm going to talk about a few more of the drug manufacturer programs. I just like to also state that Cynthia and I came up with this idea because in processing the applications for Helping Hands, we noticed that individuals may sometimes have more expenses due to their medical care costs. So we've thought that if, we brought these programs and these specific programs, that maybe that'll alleviate some of the financial stress that we see some of our applicants under. Again, I actually called all of these programs to see the application process, which is how we came up with these slides. I will say that if you're a social worker or if you're a referrer, healthcare professional, your applicants will likely need your support. Some of these programs are really hard to navigate. Not all are available in other language besides English. So applicants and clients and your patients will likely need your support in applying for these programs. Medexus has an iXinity savings program, which covers up to $12,000 per year for the iXinity specific medication. And again, like Cynthia said, a lot of these programs don't accept individuals who have government insurance, essentially. So iXinity is no different. It requires commercial insurance. There's no income requirements, and the applicant does not have to be a U.S. citizen. Yes, Lourdes Arvelo, we will, I'll explain that in one moment. And then Novo Nordisk has the product assistance program, which provides medication to qualifying applicants at no charge. You can read the eligibility below. And I will say that we were initially going to have this webinar a few months ago. So this information is accurate as of October 2022. So again, I definitely recommend that you use the links and the phone numbers provided in this slide deck to call and confirm or encourage your patients or the individuals that you work with to call and confirm that this information is up to date. Next slide, please. And then Octapharma has the Compassionate Access Program, which will provide Octapharma factor therapy at no cost to eligible applicants. They also have the Factor My Way copay assistance program for Relate, and eligibility is listed below. And then Pfizer has the Pfizer Factor Savings Card, which provides copay, deductible, and co-insurance assistance, for a Pfizer Factor product. They also have a Pfizer trial prescription program, which is a one-time, 1-month trial supply of up to 20,000 IU and no cost, and eligibility is also listed below. They also have Pfizer Hemophilia Connect, which connects individuals with patient affairs liaisons, which actually those are individuals who are staffed with going over all of Pfizer's different programs and the resources they offer, which actually is really beneficial. And then Sanofi has the Eloctate financial assistance programs. These applications are available in English and Spanish. I can confirm. The eligibility is listed below, and copay assistance of up to $20,000 per year. So it can be really beneficial. And then they also have the Alprolix financial assistance program. Those applications are also available in English and Spanish, and is very similar to the other program that Sanofi has. And then in terms of Takeda, they have a copay assistance program they help at hand, similar to our Helping Hands program in the Hematology Support Center. And the eligibility is also listed below. And they have different phone numbers for the different programs that they offer. So depending on what your applicant or client or patient may need, there are different phone numbers. And that's it for the drug manufacturing resources that we offer. I'll turn it back over to Cynthia to give thanks, and then we can address Lourdes's question momentarily.
Yeah, so thank you for attending the webinar. We do suggest that you sign up for the social work news. It's a newsletter that we write specifically for social workers, and has a lot of great resources when we get that out. And then our email is on there. That goes to our Helping Hands email goes to the entire Helping Hands team. So we can hopefully answer it right away. But if you have any questions about any of our programs or resources, or you just have a tricky situation, we are there to help in any way that we can. And that includes if you have patients that are needing assistance with medical bills. We can't help with medical bills or programs, but we can help with other bills, such as their household bills, to help let them cover the expenses of their own. So any of those situations come up, please always feel free to reach out, because we try and find all the ways in which we can get around it to help. So definitely always feel free to reach out to us. We are really happy to help. Any question is a welcome question. And then to answer Lourdes's question, so the financial planning program and job search assistance, our Helping Forward program right now is our little baby. It's just starting. Right now, our biggest support through that is the Job Readiness Grant. But we're really hoping in the new year we'll be able to provide more webinars specifically to community members looking for financial support and job search support. We do have resources on our website, potentially, if they are currently on there. If not, I do have a PDF of it if you want them right now, but they will be on there before the end of December. But they include a whole bunch of skills classes that you could take, that any applicant could take, any financial assistance we know about when coming to financial planning and job searches. We have a bunch of resources explaining the differences between different loans that are available and different programs such as that, talking about rent-a-center type expenses and the kind of loans that we're seeing in a lot of our applications. And then for job search, we have a ton on resume building, on where to find jobs we also have job portals linked in those resources. And then if you go to our Learning Central, we also have courses on financial planning and job search and job rights. And then we'll also have one coming out soon for financial literacy, which we're really also excited about for that one. But like I said, it's our baby program. It's what we're developing right now. And we see really big things coming from it in 2023. And as we kind of grow it, if you see any specific things, because you guys get to work one-on-one with community members and you get that day-to-day interaction, we really want to hear about it. So we ask about it in our surveys a lot, just seeing kind of the impact that community members experience while they're trying to navigate this crazy world. But if you have any unique situations or any challenges or barriers you're seeing come up a lot, let us know, and we will do our best to find ways that we can provide resources to help with that. And then, oh, sorry.
Oh, go for it. I'm sure you saw the same question that I did.
I'm scrolling through as I'm talking. So one thing I did want to mention that some of you probably did notice. So Helping Hands portals are closed right now. Like I said, there's always a way around it. If you have anyone in a true emergency, so our portals will open back up on January 9th. But if you have anyone facing eviction or shut off, repossession, anything like that, email us. If you've done the application before, please try to include all of the information that's in there that you would normally provide in an email. And then we will just make that application and we'll reach out to them as soon as we can. If you've never done the application before, totally fine. Email us and we'll walk you through all the information that we need to be able to do it. Closed doesn't necessarily mean closed when it's for right now. And we will actually be fully closed the week of Christmas. But before then, if you have anyone with any pressing emergencies, we are here to help, even though our portal technically says we're not. We will always work around it a little bit. But I do always want to mention that as well. Do you offer the webinar for the community, also for social workers discussing the job readiness grant and job resources? So we have not made any specific like social worker presentations on sharing the job readiness grant and job resources, mostly because it's so brand new and fresh, and we are kind of like working through all of those. Our plan is to start January with a full promotion plan on how to get this job readiness grant out there and get our job resources to everybody. So that is definitely in the works, to have one specific for community members, and then to also do presentations such as this one where we're working directly with social workers, because I have had so many of our awesome recipients tell me they heard from their social workers about the job readiness grant. So we know that you guys are our #1 promoters, and that's who we're going to go to with information, and you help guide them through the process. So we definitely will do some kind of information, hopefully in a webinar setting, or at least educational email telling you about the process and everything with that. But as always, if you have any questions specific, always feel free to reach out.